Ladies and gentlemen, let's continue with the introduction to the research on the effects of Qigong massage on autism. After creating the handbook and DVD, Dr. Silva needed to see what parents could accomplish on their own with training and support. A randomized controlled trial of the QST parent intervention was published in the American Journal of Occupational Therapy in 2011. The trial consisted of 47 autistic children under the age of 6. Evaluations were done by teacher, again blind to the group, and by parents. Parents received an initial 3-hour group training, followed by 7 weekly support visits by therapists. After 5 months, sensory and self-regulatory and parenting stress improved significantly in the treatment group, but not for the control group. The results were similar as in the dual intervention study. Behavior also improved by both teacher and parent accounts as much as in the dual intervention. But they did not see the same improvement in language as they saw with the dual intervention. When Dr. Silva broke this out according to more and less severe, the less severe child did as well as in the dual program, but the more severe did not. They would have benefited from the 20 extra therapist Qigong massage treatments. The parent-only intervention was an effective intervention for autism, and it was less expensive for the early intervention programs to give. Only 8 therapist visits in 5 months compared to 20. The less severely impacted children did as well or even better than those in the dual intervention. The parents were able to do what was needed, and it was empowering. Let's revisit our model for autism. Now, if sensory and self-regulatory impairment are the cause of social and language delay and abnormal behavior, then treatment of those sensory and self-regulatory symptoms should reduce social language delay and abnormal behavior. And this has been proved with the research, it was the case. Now, this means that sensory and self-regulatory impairment should be specific to autism and differentiate children with autism from other groups. So this was Dr. Silva's next area of research, to develop and test an assessment instrument that would differentiate children with autism from those with other developmental delays. The sense and self-regulation checklist was a home run. The validation study showed that children with autism were clearly different from other children by virtue of 2 main things. There was global delay of early self-regulation milestones, and touch was severely abnormal with pain and numbness on many areas. It was appalling to think that the millions of children with autism worldwide have damage to the sense of touch. Yet there was no other explanation for the findings. There was no known brain condition or genetic condition that gave that combination of pain and numbness on different parts of the body. These were common signs of neuropathy, the most common cause of damage to the sense of touch. These findings resulted in a revised model for autism. At the center of the model, we see now tactile and self-regulatory impairment as a primary cause of autism. To validate this model, some questions were still remaining. Are touch and pain abnormalities present in all children? On which areas of the body? And do touch and pain abnormalities cause self-regulatory delay? Dr. Silva's next study answers these questions. Abnormal pain responses were universally present as confirmed by parent and therapist reports published in a study in 2013. It turned out that touch was severely abnormal with pain and numbness on many areas, including the scalp, the face, the mouth, the hands, and the feet. Moreover, data showed that the severity of touch problems was directly and proportionally linked to the severity of self-regulatory delay, as the graph shows here. The worse the touch problems, the worse the self-regulation problems. The research was published in an International Journal of Massage and Bodywork in December 2013. It was a retrospective analysis of the Qigong massage database that now existed of 129 children with autism under 6 years of age, 97 in the treatment group and 32 on the waiting list controls. A hypothesis for which part of touch is abnormal in autism. An exploratory skin biopsy study was performed to rule out neuropathy. We know that seed tactile fibers compose 75% of touch fibers in mammals. These fibers register pleasant stroking touch and are important for bonding and soothing infants. They also register pain with injury and temperature. All of these are abnormal in children with autism. Loss of these fibers results in lack of pleasure in close affectionate contact and abnormal responses to light touch, injury, and temperature. Loss is diagnosed by skin biopsy and special staining. The biopsy study results came in, and they were abnormal. In some of the samples, the small sensory nerve fibers that mediate touch, pain, and temperature were damaged. In others, they were too few in number. A 50% loss of seed tactile fibers was found. This opens the door to prevention. There are known causes of neuropathy, and hopefully the Italian team that was processing the biopsies will be able to discover why it is present in children with autism. The study was published in the Journal of Neurological Disorders in 2016. We have now a valid model for autism, a credible explanation for why Qigong massage works. In May 2013, sensory abnormalities were included in the diagnostic criteria for autism, finally, making the model relevant to autism. And the model makes sense. Parent touch is necessary to stimulate early self-regulation, which in turn is necessary for social development and behavioral self-regulation. This is nothing new. Tactile abnormalities in autism present a barrier to parent touch, and QST techniques are successful in treating the tactile abnormalities, stimulating self-regulation and restoring touch into the parent-child dynamic. Self-regulatory, social, and behavioral development normalize after Qigong massage treatment. Autism becomes less severe. Here are some videos. Significance of where the tactile difficulties are. Fingers pointing.
It's all right. It's okay. You love that, don't you? You're just excited. You want a good rest. You got a good rest. You didn't sleep. You never do, but...
Chest, self-soothing.
Here's your chest. Yeah. Good. Ooh, wiggle, wiggle, wiggle. Wiggle, 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 wiggle.
Hey.
Easy, 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 easy.
Oh.
Pick him up. Soften a bit. Come around.
Feet, gross motor.
Dos, tres.
And for the first time, he has pleasure and even play with his feet.
Ears, receptive language.
Ears. No, I don't like the ears. No, I don't like the ears. Ears. Ears.
There's usually resistance to massage at first.
Down. And I think what I'm going to do on this one today is just put down.
The techniques are effective and it is worth persisting. 1 month later.
All done. Shoes and socks.
I don't know what socks are.
Shoes.
With time, children stop resisting and learn the massage.
You're giving the bear his massage. And you're doing the doll.
And give it to each other. Two autistic brothers.
Yeah, good job.
For the 1 and 2 year follow-up results in preschool children, one conclusion is clear. When parents continue giving the massage 6 days a week, children continue to make progress towards catching up with their peers. But when parents stop giving the massage or drop to a few days a week, progress stalls. It was sad to see children not get full benefit, but the published results are able to give parents strong reasons to stick with it. The blue line are the abnormal oral and tactile responses. The green line are the childhood autism rating scale. 2-year results of all 4 components of autism. After 2 years of treatment, on average, the severity of the autism decreased by 44%. 1 in 4 children moved off the spectrum, and there was 100% recovery of the sense of touch. The blue line represents Vineland socialization. The green line represents Vineland daily skills. Yellow line represents preschool language scales, and the orange line represents autism behavioral checklists. And yes, the treatment is effective in older children. A controlled study of 35 elementary school-age children showed similarly large improvements of touch at 5 months and 1 year. Behavior, socialization, language, and living skills improved comparably, as did improvement in child-to-parent bonding, affection, and eye contact. It was remarkable to see high-functioning children who already had full language made progress more rapidly than had ever seen. With normalization of touch, they could build on their already acquired skills and boost their development. The functioning children also progressed, but more slowly, as expected. What will happen now is that evaluation should be evaluated with QST massage as soon as touch problems are found. The technical name for this is dissemination. To help the dissemination progress, Dr. Silva refined the sense and self-regulation checklist and renamed the checklist. They had collected data on about 400 children, half with autism and half with normal development. In the process of analyzing the data, they found something astonishing. 5 questions about severity of pain on the face and in the mouth, not a single question about language, social development, or autistic behavior, and they could identify 82% of children with autism. When they added the questions about orienting to the questions about the face and mouth, they were accurately able to identify 92% of the children with autism. The autism touch and self-regulation checklist is a validated parent caregiver questionnaire that assesses abnormal tactile responses by location and severity in the context of daily life. Higher scores reflect greater abnormality. Dr. Silva's research pretty well explains autism. The face is what we orient with. Damage to sensation on the face early in life would prevent the brain from learning to orient to another person. Being together, Face-to-face is where social development begins. It seems that in autism, it's being hindered right at the source. Difficulties with touch on the face and in the mouth are present in almost every child with autism. We are born being able to orient to another person's face. It's called the orienting reflex. It's a simple sensory motor reflex whereby the mother touches the cheek and the infant turns towards her to nurse. Sensation to the face and the mouth is provided by the trigeminal nerve. If sensory fibers are damaged, the areas will be painful or numb, and instead of turning towards the mother, the child will turn away or fail. Now, did she make a difference? Dr. Silva brought the Qigong massage treatment from theory to evidence-based treatment for autism. They carried out and published a dozen research studies showing that 5 months of treatment resulted in decreased severity of autism by 1/3. It improved touch response by half and decreased parenting stress by 44%, and improved social and language skills. In the process, they empowered thousands of parents to help their own children, seeing reduced stress in the families and helping children onto a better developmental path. On-site and online programs were developed for professionals and made available in the US, Europe, and South America. The way that autism was being thought about and treated was changing. In the process, they brought together Chinese medicine ideas with Western scientific ideas and introduced some of the most beautiful parts of Chinese medicine to Western families and early intervention programs.